Welcome to Families First in Essex County's Compliance, Code of Conduct, and HIPAA training. If the slideshow is moving too fast and you need to read one of the slides, please pause the video to do so. I want to be sure that you're getting all of the information that you need. This is my contact information and our compliance hotline and compliance email address. I like to start out by reviewing our mission and vision statements. These are the philosophies that drive us in our work at Families First. We, as an agency, are committed to walking side by side with families who need support when they're struggling with various issues their children are experiencing. We used to work specifically with children and families who were facing emotional and/or behavioral issues, but in the past several years, we've expanded into other healthcare needs as well. We want to be sure that we're always doing the best we possibly can. We want to be certain that when families receive services from us, they're always receiving top quality services. In saying this, it's important to note that we have specific guidelines, rules, laws, and regulations to follow. These instituted by the agency, our payers, oversight agencies, local, state, and federal government, as well as professional standards and expectations. In order to run a compliance program, we had to gain approval from the agency's board of directors. Every policy and procedure that we follow has also been approved by the board. It's mandatory for our agency to have a compliance program, and it's mandatory that we provide and document compliance training to our staff and board at least once per year. This should occur by the end of January each year. During this training, we'll review various aspects of compliance, including what it should look like within our work environment and different parts of our program and plan. Families First, we strive to work within a culture of compliance. That means that when we're doing our work, we're mindful of the various rules, regulations, and laws that guide us. We value employees who take pride in their work and in being compliant. We admit our errors and work diligently and quickly to resolve them. We support one another in compliance. This will help us all to protect the agency, each other, and our clients. On this slide, we're asking what it means to have a culture of compliance. You can see by the list that it's quite a big expectation. We want compliance to be part of the fabric of Families First. We want to be certain that the work we're doing falls within the rules that have been set and that we're doing our work proudly and to the best of our abilities. We want to know that each member of the staff is well aware of the agency's values, that we hold each other accountable to that. In these ever-changing times, this is certainly an important aspect of doing business and will certainly ensure that we're able to thrive and grow moving into the future successfully. While we do have a compliance plan, it's not the only document that governs us. We have myriad laws, regulations, and rules that we must follow. The compliance plan solidifies our commitment to follow all of these many guidelines. It also outlines our commitment to ethical standards and behavior and practice. It's like the umbrella under which all of our operating standards exist. Every compliance plan is required to have certain elements. Our not-for-profit agency that receives payment from Medicaid is required to contain 8 elements that you see listed here. This is the first element. We're required to have written policies and procedures. Additionally, the compliance department assists the other agency departments in creating and implementing their policies and procedures. It's my job to know and have access to the many documents outlining the various policies and procedures. It's my job to ensure that the agency is safe from fraud and waste and that we are always following all of the rules, regulations, and laws under which we operate. The policies and procedures you see here are specifically related to compliance, but there are many other policies and procedures within the agency and each department. This is the second element. When Families First reached the threshold of billing at least $500,000 to Medicaid, it became necessary for us to maintain a formal compliance program and for the agency to designate a compliance officer. That's me. I'm Robin Nelson. My office is next to the door between the front office and the back offices. Although I'm not always at the physical plant, I am always available for anyone who has any compliance-related concerns. I can be emailed, reached by phone, or if I'm in the office, you can always come in and talk to me. Maybe it's because you're not sure if you're doing something correctly. Maybe it's because we have heard something that concerned or alarmed you. We have a compliance officer to help guide staff members in decision making, support staff members in submitting work that is clean and in compliance, and to process any concerns, complaints, or reports of non-compliance. My responsibility is to ensure that accurate information is disseminated and that concerns are investigated and resolved. When there are official concerns, complaints, or reports, it's also my responsibility to report them to the Compliance Committee, which is part of the Board of Directors, the Governance Committee. The committee not only reviews and approves policies and procedures, but also processes incident reports and any compliance reports or complaints. Things that I've already reviewed. Basically, it's saying that I have to make sure that we have everything we need to be able to follow all the rules and regulations. When there's a misstep, I can figure out what it was and how to resolve it. Sometimes that means updating or changing a policy or procedure, or sometimes it might mean facilitating some sort of disciplinary plan or action, and sometimes it may even mean paying back overpayments or funds that we received in error. This is element number 3. Training and education. It's pretty self-explanatory, I think, but that's what I have to do. I have to make sure that everyone knows of our compliance department and plan, and that each individual associated with Families First in whatever way has all the information that he or she needs to be able to participate successfully and within compliance. Foreigneous means that I have to make sure that our compliance program is symbiotic with the rest of the agency, and that the agency is symbiotic with the various elements that oversee things. Everything should work in harmony. If we have a policy and or procedure in one department that is in direct conflict with another department or within the agency as a whole, I have to review the two issues, find a solution, and figure out how to make them work together. I also have to be sure that everyone who works with or for the agency doesn't have any elements of their lives that could possibly cause a conflict for Families First. I have to inform you to report non-compliance yourself or with someone else, and you have to be sure that you'll never face any sort of intimidation or retaliation because of it. The compliance department is also responsible to safeguard the protected health information and identifying information of our clients as well as our staff. Lines to the compliance officer. I have to make sure that you always know how to contact me and that there are many avenues for you to be able to do that. I have to make sure that you can contact me directly or anonymously if that's what you prefer. We have a dedicated cell phone with caller ID turned off so that someone can call that number confidential and me knowing who it is. The voicemail is confidential and I'm the only one who can listen to it. While I'm obligated to investigate and report any reports that I receive, I am not obligated to reveal the source, and I never will unless the person asks to be revealed. Aside from the dedicated cell phone, there's also dedicated email, snail mail, and a drop box outside of my office, and you can always come to see me in person or ask to meet with me in person. You can come to me for all sorts of reasons. It may be that you need advice about how to complete something. It may be that you're not sure if something is billable. Maybe you're not sure if you're facing a conflict. You can also contact me to report non-compliance. Maybe you know that someone is billing for something that they're not actually doing. Maybe you know that you accidentally submitted incorrect billing or that you accidentally overbilled for something. Maybe you know that someone is stealing from the agency or is discussing our clients in some unethical or non-compliant way. These are all things that you can discuss with me. My job is to either point you in the right direction, give you the correct information, or investigate and resolve whatever the issue may be. I'm not your only option, though. You can also go to your supervisor or to the executive director. If you're reporting a compliance issue to one of these people, they're required to report it to me, but they're also required to keep your confidence if you ask them to do so. They're bound by the same standards as I am. They cannot intimidate or retaliate against you. They're required to handle your concerns in an expedient manner. All right, I'm not going to go through all the disciplinary policies here, but each department has a disciplinary policy that starts with verbal warning and on need. Sometimes it's a corrective action plan. Sometimes it may be that, that's all someone needs. Sometimes it may be that, they need to go on probation for a specific amount of time. After that, their performance would be evaluated and next steps would be decided. Sometimes it could mean termination of employment. There is a spectrum of possibilities depending on the violation. Be aware, though, that violating the compliance plan includes failure to report non-compliance. So if you know that someone is in violation and you're not reporting it, you could also face disciplinary action. There can be situations that would require us to involve law enforcement. It all depends on the violation. Please always check your work before you submit it. Be certain that your times and dates are correct. Be certain that you're in the correct chart, not accidentally entering someone else's information into the wrong chart. If you're always honest in what you're documenting, you shouldn't have anything to worry about. Do not copy and paste the same information into multiple charts. Without fail, when someone does this, he or she accidentally puts someone else's name in the wrong chart. Take pride in your work. Your plans are the prescription by which you provide services, and your notes are the receipts for those services provided. Always be sure that your plans are up to date and relevant. Be sure that your notes are in direct connection with your plans. Also, make sure that your plans are directly related to the strengths and needs of your clients. These things are all very important in being sure that you're doing the best job possible. All your documentation should be like a tapestry of your work. So I'm required to give you examples of what can happen if someone is caught trying to defraud Medicaid. Here's an example of an agency in New York. There was vital documentation missing from charts to prove services were provided. There was billing for services that were not deemed medically necessary. The agency had to pay back more than $250,000. Medicaid doesn't just take back the monies connected with the missing documentation. They take back a percentage across the board, assuming that if this happened once, it probably happened multiple times. This amount of money would devastate our agency, $250,000. It's our responsibility to make sure that we never face such a situation. If you're using flexible dollars for clients, you must document this use in multiple ways. For example, you must submit receipts have been planned for in the plan, and progress notes should document the exact amount that was spent, what it was spent on, and who received the benefit of the expenditure. The receipt must be signed by the client, and the voucher with the receipt must be signed by the person spending it as well as the supervisor who's approving the expenditure. If monies have been spent and there is no supporting documentation, the agency could be at risk of having to repay a large portion of that money, and the person who spent it could face legal action. In another situation, a woman was caught in prison or she was charged with Medicaid fraud, false pretense, and was facing up to 10 years in prison and or fines up to $2,000. All right, so this is Compliance Plan Element 6, identification of compliant risk areas and non-compliance. This means that we're consistently running risk assessments and audits. We're checking to make sure that all of our relationships are clear of compliance risks and that all of the work that we're doing is being done in compliance with the various rules, regulations, laws, etc. that guide us. I'm responsible to find these responsibilities so far throughout the video. I am responsible to find areas that need help, and I'm responsible to respond to the issues and help to repair them. But it's important to note that while I'm the person who oversees this, it's everyone's responsibility to ensure that the agency is safe from risk. All-inclusive, but of areas that we're required to audit. It's not all-inclusive, but instead just a sample. Issues, again, Element 7. Responding to compliance issues, again, report any issues with compliance, please. If you're not completely sure, let someone else decide. Just report your concerns and let us figure out if it's a violation or not and what to do about it. None of us has to be in this alone. Also, any report of non-compliance is always reported to the executive director unless it's directly involving the executive director, then it goes straight to the board. Report is made. Everything that must be followed when a report is made. Everything must be documented, investigated, and responded to in a timely manner. Anyone making a report is safe from retribution. This is Element 8, non-intimidation, non-retaliation. If you're honoring our culture of compliance, you will always be safe. If anyone attempts to intimidate or retaliate against another for reporting noncompliance, that person will be disciplined, which could include termination of employment. All right, so this next helps us to know for certain our code of conduct. It's meant to give staff members something to lean on. It helps us to know for certain what the agency deems as the difference between right and wrong in terms of conduct and behavior. It helps provide a framework for professional relationships. Part of the code of conduct illustrates our commitment to the following ethical standards within our various relationships. We need to be able to say to stakeholders that we can be counted on to provide quality services within ethical standards. We will follow the rules and regulations and will behave professionally and ethically in all business matters. Will not only be good reflections of ourselves, but also the agency and our stakeholders. The agency's conflict of interest policy. If there's something that may influence your decision making with regard to your work, such as your affiliation with another person or entity, or perhaps a chance of some sort of monetary gain on your behalf or that of someone connected with you, you must report this possible conflict to your supervisor. You may proceed with whatever the decision or activity may be. You may not accept, solicit, or offer anything of value to or from anyone connected with your work at Families First without receiving written permission from the compliance officer. Conflicts of interest. There are good examples of conflicts of interest. They're only examples. There are so many ways that a person could face conflict of interest. Ask. Acceptable to accept questions. So, is it acceptable to accept money or gifts from participants or their families? So the answer to this one is that you must receive permission from your supervisor for any gifts under $50 value. You should really never accept any money. That just puts your professional relationship in a weird position. And you shouldn't accept any gift worth more than $50, but you should report all offers. So what might be the perception of other participants or your coworkers if you accepted money or gifts from participants? You know, this answer to me seems like it could be subjective, I suppose. I think that maybe you are using your client, or maybe that you're being condescending. I maybe would think that you're not behaving in a very ethical way, but that's from my frame of reference. Not everyone will feel the same way. Some people may think it's okay. Our agency has policies to keep you from having to make decisions all by yourself. If you take money or gifts, should you report it to anyone? No, you shouldn't take it without permission. If you do end up receiving something, you should report it to your supervisor right away. And, who should you report it to? Well, you should report it to minimally your supervisor. If it's more serious type of gift or something worth a lot more that someone's offering to you, you should report it to the compliance officer, which is me. Okay. Our whistleblower policy mirrors the non-intimidation, non-retaliation policy. If you have a complaint or need to report some sort of violation, no one is allowed to retaliate against you and start talking about HIPAA. So now we're going to start talking about HIPAA, the Health Insurance Portability and Accountability Act. This is what safeguards protected health information. As our compliance plan is required to contain certain elements, so does our HIPAA plan. And here they are. The document to clients when they begin our notice of privacy practices. We also must provide the document to clients when they begin working with us and obtain a signed acknowledgement. There are various ways that we can obtain acknowledgement. We also must review this policy annually with clients so that they're sure to know that their information is safe with us. So many regulations regarding uses and disclosures. For the most part, we must obtain permission to use or disclose any information about our clients. It's important for you to be aware of what info and to whom they have given authorization. They can revoke these authorizations at any time. You must be aware of the date of revocation and follow their wishes. Also, if someone gives you permission to use and you actually do that, you need to keep a log of the uses and disclosures. That's really important. So you're going to put down who the client was, the date of the use or disclosure, to whom the use or disclosure was given, and or disclosed. Used or disclosed. There are specific laws regarding AIDS status and alcohol and substance abuse that require different types of. So if you come and see me so I can use or disclose any of that type of information, come and see me so I can make sure you have the proper form. So the next thing is minimum necessary. This is an important aspect of privacy. Do not have open conversations about your clients ever. Do not stand out in the hallway or sit at the lunch table discussing personal information about your clients, because in so doing, you're violating the minimum necessary rule. Also, you're not going to talk to someone about something that's not related to a need. So if you're going to see your supervisor about a specific issue with your client, you don't need to talk about something that's not related to that specific issue. Protected health information. So ask yourself, is my workspace HIPAA compliant? Do you have any sensitive material exposed? Did you know that you should not have any photos of clients displayed in your space? To live and work, be challenging to live and work in the mindset that everything about a person is private. Imagine though, if it were you or your family member. What if you were walking toward the restroom in your doctor's office and you overheard two nurses talking about your family member, or saying that the person was being difficult, or you could detect obvious frustration in their voices? What if you walked into the examination room and saw your neighbor's chart open on the desk and could see diagnostic information? Yikes. If you're driving with your client's chart in your car, you must keep them locked in the trunk or out of sight and secure. You don't want papers falling or flying out of your car, or someone in your car rifling through them. You also don't want anyone being able to touch the mouse on your computer and then being able to see whatever it was you were working on. You must always have a password-protected screensaver to automatically lock. Walk away from your computer, it will automatically lock. When we had to close the office for COVID-19, I went from office to office checking for HIPAA compliance, and I found that a few of the offices were not compliant, and because of this, I had to make sure that the office doors were locked. But in reality, we shouldn't have that sort of situation. Protected health information should be locked in drawers or cabinets. The office should be locked. Ways to keep our clients' information safe. Innovative ways to keep our clients' information safe. Please be mindful and keep your workspace safe. Recovery plan, and it's overseen by the compliance committee, which is the governance committee of the board. This plan is for if there's a data breach involving more than 500 people, or if there's some sort of incident at our office that causes protected health information to be exposed or destroyed, or something that can cause a major loss of financial security or confidence in families first. It's meant to give us a framework from which to work if we need to recover data, report a breach, and or do damage control. In all ways, we strive to protect our client and our agency. It may seem redundant to review this information, but it's so important that we all understand how valuable personal health information is, and any personal information, really. Our clients trust us to keep it safe, and this is a solemn responsibility. Please be certain that you're following all of the agency's policies and procedures regarding protecting. High-Tech Health Information Technology for Economic and Clinical Health Act. This is a set of guidelines that assists us in developing processes and procedures related to electronic storage of protected health information. It requires us, for example, to use electronic health records, and our electronic health records must be high-tech certified. That means that the electronic health records we use are. Additionally, high-tech guidance gives certifying them as secure. Additionally, high-tech guidance gives specific instructions of when and how to report data breaches. Oops. The use of social media is allowable during my workday. So Families First is really flexible, and no one's going to call you out for checking your personal email or going on Facebook for a few minutes now and then. But if it begins to interfere with your work, that's of course a different story. You should never post anything disparaging about the agency or anything about any of our clients, of course. It's okay to use whiteout on documents. On your own personal documents, sure, but on any legal documents, no. N-O. Do not change anything on your work with whiteout, ever. Not any of your work. If you make a mistake, put a line or 2 lines through it, initial it, and make the correction. Do not use whiteout. Through it, initial it, and make the secure way to. The only email that you're allowed to use to transmit to guarantee that the email will go out encrypted, your agency email. Our email is encrypted. Sometimes the encryption doesn't work, so I have a dummy social security number that I add to the bottom of my signature line to guarantee that the email will go out encrypted. It's just 123-45-6789. When I send an email with that, it automatically becomes encrypted, and so I don't have to worry about what's going out there. But sometimes other email recipients can't receive encrypted email from us, so I just add it to my signature line if I know that there's something in there that I want to make sure that it's encrypted. Backdating documents is okay. Nope, it's illegal to backdate any legal documents. So that's just a no. Submitting for sick time when I'm out but not sick is okay. But you want to have some kind of, first, if you need a day off, or sick time is meant for health reasons. You can take a sick day. Sick time is meant for health reasons. You can take a sick day if you need a mental health day, but make sure that you're communicating with your supervisor about that. Talking to my significant other, family member, or best friend about a client is okay as long as I don't say his or her name. No, it is not. If you need to discuss a client, go to a member of that family's team or to your supervisor. Remember to keep it strengths-based. You can accidentally reveal someone's identity by talking about their circumstances. That happened to me actually once regarding my daughter. In all fairness, the person talking about her didn't realize who my daughter was, but the way she described the situation, I knew exactly who she was talking about. My car is okay. Only if it's out of sight and secure. Best practice is not to keep client information in your car at all, but we all know that that's not realistic, that you're keeping it safe and secure when it's in your car. Talking to a past employee about a client that he or she knows is okay? No, it isn't. Not at all. Once someone leaves Families First, all information about clients becomes private. Allowing my child to use my work phone or computer is okay. Nope. You can accidentally reveal protected health information that way. Also, the devices that you're using from work were borrowed from the agency. Please do not lend them to anyone else. You're responsible for them. So please keep the compliance information, know how to get in touch with me, or so that if you ever need to, you'll know how to get in touch with me or this department. Thank you for completing the Families First in Essex County's compliance training video. I hope you learned something.